Hi, I'm Ryan Starnes with Integrative Personal Training. I'm going to talk to you about hip mobility and why it's so important to have good hip mobility to have a healthy low back. So if my hips are tight, if I don't have as much range of motion in my hips as what I should, and I'm doing activities where I'm rotation, where I'm flexing, and my hips are essentially maxing out early and how much motion they're allowing, my low back can end up compensating. So my low back can end up moving more than it should to make up for a lack of hip mobility. So this is important because the compensation that can occur in the low back is essentially the low back is moving further than what it should be doing. That excessive motion can cause injury to the ligaments and the muscles that help to stabilize the spine, which over time, with continual overstretch and injury, can actually make the spine less stable. So hip mobility is very important for spinal stability. Now I'm going to talk about ways to assess hip mobility, and then we'll go ahead and head into some different stretches and other techniques, ways to actually improve hip mobility. All right, so let's go ahead and look at assessing hip mobility. I'm using a stool. If you've got a chair, a couch would be too soft probably. Stool or a chair, please, or a table. Coffee table may be good. What we want to do is have the hips and the knees be about the same height. So I've got a 90-degree bend in the hips. If I'm too low, I'm going to be here. If I'm too high, the opposite direction. So we want to make sure that the pelvis doesn't move. We want to keep that fixed. So we're just looking at range of motion of the hip. We're going to be looking at rotation specifically in the hips. We'll start with external rotation. So I'm going to keep my femur straight. So I'm not going to allow my knee to come in or to go out. And I'm going to go ahead and bring my foot up and in so my femur is torquing in this direction, the direction of external rotation. So I'm going to look at the angle. If I drop a plumb line straight down the floor, look at how many degrees I'm able to go heading to my current position here. So this is perhaps 35 degrees, maybe 40. For external rotation, so again the foot coming in, the femur is externally rotating, we're getting external rotation of the hip. We're looking for what's called a passive test. So if someone were to physically hold my leg and move it, we're looking for between 40 and 60 degrees. Because this is active, I'm using my muscles to create that motion, it's going to be less than that. So if you're hitting 40 degrees, I'd say that your external hip rotation is going to be good. We'll do that same thing on the other side. This can be very important as well, because if you've got more hip rotation on one side than the other, you've got kind of a control to compare to. So that can be an even more important indicator if you have an asymmetry. So on the other side, hip rotation, and this is going to be hip external rotation. This is going to be comparable to my right side. So these are pretty close. So that's external rotation. Again, if you hit about 40 degrees, I'd say that your external rotation is good. Now, internal rotation is going to be the opposite direction. So my foot is actually going to come up and out, even though my hip is internally rotating. So it's a little bit opposite, right? On this guy, the passive is going to be passive range of motion. We're looking for someone actually doing that for us between 30 and 40 degrees. Now this is active again, so it's going to be less. So if you're hitting 30 degrees for internal rotation, you've got good internal rotation. And I'm actually below that on the right side, so maybe 20 or 25 degrees. And then we'll do that same thing on the left, right? So internal rotation. Now I have less internal rotation on the left side, maybe 15 perhaps. So it'd actually be important for me to work more on the left side. So I can do 2 stretches on the left side and just 1 on the right, because I'm tight on both sides, but I'm tighter on the left than I am on the right. So that's internal rotation. Again, aim for about 30 degrees of range of motion for internal rotation and about a 40 for external. Now, if you tend to favor one, if you have a lot more external rotation, hardly any internal rotation, or vice versa, like you'd also keep in mind that the shape of our femurs can help determine how much internal and external rotation we have. So some people, and this is actually quite common, can be kind of fixed in external rotation. So if you see people that kind of walk with their feet out, there's a number of reasons that can happen, but one reason is that the neck of the femur is attached at an angle that kind of predisposes a person to be in external rotation. The same can happen the other direction for internal rotation. So if that's you actually don't want to aim for those norms, right? Because you're working with anatomy that's specific to you. We're not going to aim for the average numbers. If you push yourself into that, you may actually cause more problems. But if you have been told that's not the case for you, or you don't believe that is the case for you, and especially if you've got one side that seems good range of motion, the other side not, we'll go ahead and try out these stretches I'm going to show you here next. So this is a stretch we'll use if we scored tight on internal rotation. So if we do not have as much internal rotation as what we probably should, myself included. So go ahead and lie on your back, open up your feet, but keep your knees close together. I'm gonna let my knees actually fall down towards the floor. Now I'm feeling a stretch on the outsides of my hips, and so those are the muscles that cause external rotation, right? So if our internal rotation is limited, our external rotators are tight. The muscles that pull in the opposite direction of internal rotation are tight. So I'm gonna let my knees fall in. I'm gonna go ahead and hold that for about 30 seconds. This is something I can do once or twice a day, every day. This is also a stretch for the external rotator, so this will help us create more internal rotation. I'm also going to go ahead and lie in the back. I'm going to put one ankle over the knee, put a hand on this knee and a hand on the shin, and I'm going to use the muscles, the hip flexor muscles, to pull my left knee closest to the camera, towards my chest. So I'm feeling a stretch right now in the right glute and the right deep hip rotators. I can actually change the position, so I can bring my knee a little bit more towards the camera. Will stretch out a slightly different subset of those muscles. I can bring that back and pull a little bit more on the knee, will also give me a slightly different stretch. So those are some different variables that you can play around with. If you feel like you have more tightness in one area, focus on that. Maybe the next day come back and do the same thing on a different spot. This one as well, we want to hold for a count of 30 seconds. You can do that once or twice a day, every day. So if you found that you had a limited amount of external rotation, we're going to go ahead and work on the internal rotator. So the muscles that prevent external rotation in the hip are the internal rotators. To do that, we'll use a ball. So this is going to be a massage technique. Use a tennis ball, lacrosse ball. This is somewhere kind of in between those two. The area that we're going to focus on is going to be the side of the hip and a little bit forward. So it's going to be about where your pocket's at or so. Now I'm going to go ahead and place the ball on those muscles. I'm going to lie on my side, and I'm looking for tender areas to go ahead and work on and open up. You can think of this as like a very specific stretch. So with any stretch, it's important to go slow to kind of let the muscle open up. So the ball, I'm going to sink into it. I'm going to look for some tender areas. When I find a tender area, like I've got now, I'm going to go ahead and just relax, let the ball kind of sink into that spot, and then I can kind of move around. So spend about 30 seconds to a minute on that. You can swap sides. If you want, you can go ahead and head back to the first side. This is something you can do every day or every other day. If you do it one day and it still is pretty sore the next day, go ahead and give yourself an extra day just to let that guy recover before you head back on it again. Again, we'll use the ball, use this for cases where we're trying to create more external rotation. So the hip internal rotators are tight. We're going to go ahead and see if we can work those guys out and create more hip mobility.